Good afternoon, everybody. Good day. Welcome to Dental Voice Season 3. My name is Rolando Mia, and this is Zyrus. The purpose of Dental Voice is to give professionals in our industry an opportunity to share their perspectives, opinions, and get advice. Season 3 is all about understanding how clinicians thrive, what they need to thrive, especially in their day-to-day. Today's guest is awesome. Really excited to introduce. I want everyone to meet the most awesome person on earth, Amanda Hill, BSDH, RDH. She's a returning guest to Dental Voice, and we've had an opportunity to hear from her in the prior season, and this is a fantastic opportunity to follow up with her. In addition, Amanda is also the host of Your Dental Top 5 podcast, which comes out on Thursday. So it's kind of cool. She has some incredible information there and want to get a perspective on, what she needs to thrive. How are you, Amanda?
I am doing great, and I'm so excited to be here with you today, Rolando.
Well, I appreciate that, and thank you for taking the time. So, you've been practicing dental hygiene now, 20 plus years?
Yeah.
Right, you started when you were 4. Is that
4?
Is that
yeah, I was a prodigy.
During our previous discussions, basically, you've talked about the importance of continuous education and the context of that throughout your career. And learning is an important aspect of that because it's what exposes you to other things. In addition, you mentioned that network is important because it gives you access to people, new technologies, different innovations. And this is how you learn things to create better workflow, better routine, so that you can have fun at work, right? Now,
absolutely.
Now, you mentioned that early days of hygiene, you realized that, dental school gives you phenomenal tools, a lot of information. But although these tools are fundamental to helping you understand, just using them to create an environment doesn't really address workflow issues, physical strain, stress, so that you have fun. So, if you would, please, tell us about how your workflow has evolved over the years based on what you've learned, so that having fun at work is, and how having fun at work is definitely a sign that you're thriving. So what really curious to hear more about that.
Well, certainly in hygiene school, you get about 3 hours per patient, and that won't work in the real world. You don't get 3 hours for a class 1 prophy. And so, you jump into those real world scenarios, and all of a sudden you have hopefully 60 minutes for a patient. I can't really function with a whole lot less than that. But, and I had to figure out really fast, like how to come up with a flow that was going to work for me. And so I'm a big fan of standard operating procedures, but those standard operating procedures that I had 25 years ago in 1996 look nothing like my standard operating procedures today because hygiene has changed so much today. So in 1996, while in hygiene school, I was taking blood pressure. I wasn't taking that in the op. But now in 2021, I am doing that on every patient because I understand the importance of that. And so it's really taking our learning and adjusting those standard operating procedures to make sure that you're doing all you can as a clinician. But again, it really is important to have fun with what you do, because if you're just doing it like checking a box, checking a box, checking a box, checking a box, it's going to feel like Groundhog Day. And you're going to get, you're just going to be like, I can't do this anymore. Like, I'm done. And so I always want to feel excited about what I'm doing. And I do that through trying new things too, trying new technologies and different, learning new ways to speak and all that kind of stuff. I think that's super important.
So when you see these technologies and you're kind of reaching out around that, how do you determine which will fit in and what to incorporate? Because there's so much going on right now, and there's so many things that you're going to run into.
Yeah. So, I mean, if you see all these cool technologies and they all look awesome, right? So you want all of them. Well, you can't have all of them. There's not time to use all of them. But the thing that I love to do is really to spend time networking with other hygienists or other dental professionals to understand what they're using and what they love and why they love it. And then think, okay, would that work in my day-to-day? Or is that something that I'm going to have to put off till later because I'm working on these other, 3 new technologies? Funny story. We talk about the technologies that you learn in hygiene school. In hygiene school, we got our cassette of instruments. And so I knew my cassette of instruments. And so when I graduated, I knew that I liked an H6, H7. I knew that I liked a Columbia 1314. I knew about my Gracies. And that was about all I knew about. So fast forward to just a few months ago, I'm doing a Your Dental Top 5 podcast, and I'm interviewing Anika Forbes. And she starts talking about how she's temping and how when temping, she never temps without a Nevi. And I was like, well, what's a Nevi? She's like, oh my gosh, that's my favorite instrument ever for the mandibular anteriors. And I was like, well, what do you mean? You just use an H6, H7? She's like, no, you got to try a Nevi. So I went out and I got a Nevi, and darn it all if that's not a really super cool instrument. So had I stuck with what I was doing back in hygiene school, using my H6, H7 and getting the mandibular anteriors, I would have never known without networking and talking to somebody else that said, no, this is my favorite, to try it out and see, oh my gosh, that is a super cool instrument. I'm so glad that I talked to her and tried it because, advertising's advertising. You can look through a magazine, an RDH magazine, and see all the ads. And of course, every product is the best thing ever. And it's going to save you time and save your infection control and whatever. But until you talk to somebody that is legit, hands-on using this and figure out how to incorporate it into your day, you don't know that that's necessarily something that's right for you.
That's so cool. And you're right. You only know what you know. You don't know what you don't know. And by networking, you can do that. How does integrating these new technologies affect your workflow? I mean, I suspect there's a learning curve. It's going to mess up at first, right? Or it's going to be difficult.
Absolutely. You definitely have to be patient with yourself when you're bringing in a new system or piece of technology, and you have to kind of give yourself a hot minute. And if that means that you're adjusting something else out of your workflow, then you're adjusting something else out of your workflow. It's kind of, there's a give and take that happens here. But if you find a new piece of equipment or a new piece of technology that really might save you time, or it might help the patient in a better way, like maybe that Nevi, maybe I'm gouging that tooth structure way less because I'm using that hoe and pulling up, and it's better for the patient's tooth structure. So it's worth that learning curve. And frankly, it keeps your brain active. It takes away that Groundhog Day feeling because you're like, oh, let me master this. Like, I'm going to try this instrument now. So I think it keeps it fun.
And it's interesting. You mentioned to me before when we were talking that some of these big systems, if you don't give yourself the grace to actually take a step back and learn it, what ends up happening is it ends up in a corner, and you don't. I've
got a good story about that one. I've got a good one. So I just joined a new office, and I go into this new office, and I'm so excited because I see an airflow. So a subgingival air polisher that you can do guided biofilm therapy. I've done lots of CEs on guided biofilm therapy. I've read lots of articles. I know that this is the stuff. Like, this is going to help patients. This is going to make a difference. And so it's sitting there, and I'm like, oh my gosh, this is so exciting. And the dentist tells me it's been sitting here for a year, and the current hygienist doesn't want to use it. She tried it once, and she felt like she inhaled prophy powder, and she got a headache, and she doesn't want to ever touch it again. And this is I don't even know how many thousands of dollars this machine cost, but it was not a cheap machine. And so it's sitting there unused. So I immediately, start to play with it. I'm putting it in a cup, trying it out. And then I call my dad up and I make him come in and be the patient because I'm like, Dad, you got to come try this, be my patient, because I got to try this thing, because I don't necessarily want to try it on a patient that I've never met before, especially being the new hygienist, because they're going to the front desk and be like, that lady stinks, fire her.
I'd rather do it on my dad.
Right? My dad's super totally willing, such a good sport. And so I was able to use the Isovac, which I love, and put that in, and then did the guided biofilm therapy. Easiest thing ever to do. I couldn't believe how easy it was. And so I brought the other hygienist over, and I was like, come here, you got to try this. And so we actually put the Isovac in my mouth, and I let her try the guided biofilm therapy. And she's like, wait, I'm not inhaling prophy powder. Wait, I'm not getting a headache anymore. I was like, wait, it's because you're doing it the right way. And so once we were able to get over that hurdle of the technology, so she was, A, a little afraid of the technology, B, not really using the technology according to the instructions for use, which say use HVE. So And so then it's become this great new machine that's getting utilized. And can I tell you how happy my dentist is that this multi-$1,000 machine is actually getting used? Not to mention the benefit to patients.
So how does that tie then to, again, relieving stress? Did it affect kind of the physical, everything that you're having to deal with in the practice, those kinds of things? How does it affect that and its impact on your workflow?
Absolutely. Well, I would say that guided biofilm therapy really actually shortens an appointment time. It does a lot of the work for you, which is fabulous. And I was able to, I feel like my posture's better. I'm sitting up with that, now I have my left hand and I have my right hand because I have the isovac in there, which is so cool because it's like having a dental assistant, which, hygienists, we never get one. We're like the forgotten stepchild over in our corner of the office. So that's helped me be able to have better ergonomics, have better control. The patient is more comfortable, frankly. Once you get over that initial, just like, how do you get in? Don't be afraid of it. It's been great. But, it took a hot minute. Like I said, I pulled my dad in first. Then I had them work on me. Then I brought my husband in. And then we were ready to go. And all the patients have loved it. But I think sometimes, and they like trying new stuff too. The patients actually get a kick out of it. And I think that they see that you're an innovative office. And when I talk to them about the science behind it, so then my patients know, oh my gosh, she takes a lot of classes. Like, she's really up on things. She's not practicing hygiene the same way she was practicing it 25 years ago and just telling everybody, brush and floss, because that's what I knew back then. But now I know more. And so it's able to, I think, elevate my status as a clinician, which certainly helps me feel better about what I'm doing, helps patients feel more, I think, engaged in the process, that they understand why their oral health is essential. So I think it's a big deal in helping us feel good about our profession and helping just in that workflow, understanding kind of what I'm excited about, what I'm doing, keeping patients excited. It really just keeps the day more fun.
And then all of a sudden, so I love the context around integrating, recognizing that you have to give yourself, and I love your term, a hot minute to get it in there, experiment it, use it. Yes. Otherwise, you give it a one, I'm done. And things aren't that way. Yep. If I were to ask you, thank you. If I were to ask you 1, 2, or even 3 key strategies that you could share with our viewers around finding a seamless way to basically increase your flow and help you, improve and thrive and have fun in the dental practice, what would 3 key strategies be? 1 or 2?
Well, one I would say to network. And, right now networking is not in person. Networking is virtual because, we can't be near people. But, the hygiene groups have their pros and cons on social media and Facebook, but really you can get some great tips on how to, whatever it is you need. I was just reading one last night where it was a new hygienist and she's like, I'm always running behind and I don't know how to keep, get more into an appointment. And there was probably 100 comments about different hygienists had great tips. Lots of them said, polish first. I always polish first. And some of them said guided biofilm therapy. And some of them talked about different instruments that are their favorite. But if you don't do that networking with other hygienists that are in the trenches and doing the stuff, you're never going to get those new and innovative ideas and be able to try them out and see, does that work in my workflow? And does that work with my practice philosophy, which is also important because every office is going to be different. Another huge thing for workflow is teamwork. And it's really bringing in your whole team, your front desk, your assistants, your dentist, your co-hygienist, whoever's in that team, and understand that everybody is in there for one purpose. And the purpose is to treat patients and take care of patients. And when you have coworkers that everybody's sitting in their own little box, like, not my job, not my job, not my job, the workflow gets really stymied. And I think that people start to get bad attitudes. And so really working hard to keep your team cohesive and do your best to help out your team members as much as you possibly can, so that then they're going to, reciprocate that. Because when you have that ebb and flow, your workflow really works so much better. And then the last thing I would say is never stop learning. I take an insane amount of continuing education courses because I love it. I was on a 2-hour course last night on biofilm, which was so fascinating. And I just adored it. And then I went into the office this morning and was talking to my team. I'm like, oh my gosh, you guys won't believe what I saw. And there was these slides and there was bacteria eating bacteria. And I can remain excited about all of this. And so it keeps me, I don't know, it just keeps me, excited to go into the op, excited to tell my patients this, excited to tell my coworkers this. And it keeps it fun.
I love that. And thank you for saying networking, because it gives you access to people, technology, mentors, friends, information. Team, very important. Don't just sit there in your little box, your silo, because it's about togetherness and sharing. And then this whole context of learning, I love that. And I think you're right. The more you can learn, the more you can expand and share it. Your enthusiasm is just absolutely contagious. And every time I have an opportunity to sit with you, it's fantastic. And I'm so thrilled that you could join us for Dental Voice. I would be remiss if I didn't mention, unfortunately, we don't have Dr. Fauci on today, or do we?
Here we go.
What? Wait a minute.
I wore my Dr. Fauci socks for you too.
All right. If anybody out there knows Dr. Fauci and he can get him on here, we're going to get you onto the show and we're going to talk to him. So absolutely important workflow. Thriving in a practice is about having fun. That's something I took out of here really strongly. Understanding and doing things purposely. I love that. And then networking. That's a great, I hadn't thought about that, but its impact on your ability to thrive, your ability to decrease stress is huge because you learn. So thank you so much for doing that. Thank you so much for joining us. At some point here, later on, if people had questions for you or wanted to contact you, what would be the best way to do that?
Oh, absolutely. You can go to my website, amandahillrdh.com, or you can email me directly at amandahillrdh@gmail.com. I'd love to hear from you.
Awesome. And check out your podcast on your podcast drops on Thursdays, I believe.
Thursdays. Right? Yep. There's one out today.
Well, those of you who joined us, thank you so much for doing that. If you have any questions for Amanda, please feel free to reach out to her. I love the context around it. If you like the content of this, if you have any questions for us or would like to kind of share any feedback about Dental Voice and what the topics we're discussing, would love to hear from you. Thank you so much, Amanda. I so appreciate it. At some point here, we'll see each other and we're going to get to Dr. Fauci.
One day, we're going to get there.
All right. Thank you. Take care. Have a great rest of your week. Thank you for joining us. And maybe later on you can join us again.
Absolutely.
Awesome. Thank you so much. Take care.
Bye, everybody.